Millions of Americans are facing a healthcare shock on the 1st of January. Key subsidies under the Affordable Care Act, also known as Obamacare, are expiring, threatening coverage for more than 20 million people. The subsidies were part of the original act passed during the Obama administration and were extended during the COVID-19 pandemic to increase the amount of financial assistance to those who were already eligible and to expand eligibility to more people. But the extension was temporary. Health policy experts estimate over 20 million Americans could lose health insurance. Now, without further action, the government will stop paying large portions of monthly premiums, which could more than double the cost of the premiums. President Trump had suggested healthcare direct transfer of assistance to citizens, but there is no clear plan in sight for that. So for many families, the end of subsidies means significantly higher health insurance costs. Millions of Americans, particularly low and middle income households, chose ACA marketplace plans before federal assistance made premiums and out-of-pocket costs affordable. Assume that cutting these subsidies would reduce federal outlays, but the reality might be more complicated. Experts note that if the number of uninsured individuals rises, it could shift costs to other parts of the system, such as emergency care and uncompensated services that are ultimately subsidized by the US government. Now, with insurers adjusting rates and households weighing coverage decisions, the end of key ACA subsidies is poised to reshape America's health insurance landscape in 2026. And for more on this, our correspondent, my colleague Susan, sent us this report from New York. Let's listen in.
For millions of Americans, health insurance is about to get a lot more expensive. A government program known as Obamacare, or the Affordable Care Act, helped people buy private health insurance by lowering their monthly costs. Those discounts expire on January 1st, so enhanced subsidies that helped around 22 million Americans afford coverage, that's gone. That means many families will see sharp increases in monthly premiums and deductibles, with some priced out of coverage altogether. The subsidies were expanded under former President Biden's Inflation Reduction Act, but Congress failed to renew them before the deadline. Politically, the fallout is significant. Democrats warn the lapse will hurt working and middle-class families, while Republicans, on the other hand, are divided over whether or how to step in. Economists say the change could increase the number of uninsured Americans and turn health care into a major economic election issue heading into 2026. Susan Tehrani reporting from New York for WION World as One.